Posted by u/la_kif420. Serious, what was the most terrifying thing that you've experienced while staying in a hospital? Not really terrifying, but it could have been bad, but a few years ago I had to go into the hospital because I injured my hand. I thought it was broke, thankfully it wasn't, but I was there for several hours. What was terrifying about it was the hospital was completely packed. In fact, I couldn't even get a room or office. I was treated in the hallway, and as I was waiting, they put chairs out there for all of us extras. I saw some of the local EMTs hanging out. I got to chatting with some of them, and I found out they were stuck there too. I asked why. It was because the hospital was so full they ran out of beds and they needed the gurneys, and they couldn't leave until they got one back. I asked them what would happen if there was an emergency and they needed to transport a patient now. They hung their heads, just replying, "Let's not hope it comes to that," because they had no gurney for them. Worst comes to worst, they'd have to call another city to see if they had some, which would increase their wait time for pickup. The horror of seeing the budget cuts and the overcrowding situation in the hospital was sad and frightening. I was glad for my own sake that I was able to get out, relatively quickly, well, at least outpatient, and didn't have to stay there overnight on a chair or gurney at the possible expense of someone else possibly not getting the chance to be transported because they couldn't. That was scary to think about. Apparently it happens a lot in my area. My wife used to work as a psych nurse at a hospital in the city we lived in. She was on the floor on the 4th of July about 10 years ago. I get a call from one of her coworkers telling me she'd been assaulted by a patient. She took a pretty good sucker punch, and was down in the ER to get checked out. Well, I'm with a couple of my friends, and we all head in to see how she's doing. We're sitting with her as she's laying in one of the beds, when we hear this awful wailing. We turn around, and there's this kid. Maybe mid-teens? I can see the blood on his arm, running down and straining his clothes in the gurney. Turns out, he had blown his hand to shreds playing with fireworks. The screaming was extremely unnerving. My wife was okay, but that poor kid was not. As a young adult, I was hospitalized due to sepsis. I was in the hospital for a few months. The first day I was transferred to a new hospital, I heard this loud, terrifying noise outside my door late at night and the ground started to rumble. I was in Florida, so an earthquake was practically impossible, but I had no idea what else it could be. I sat paralyzed in my bed, heart pounding out of my chest. I finally worked up the courage to press the call button. You can imagine the chuckle the nurse had when she had to tell me it was just the floors being cleaned. I was panicked. I went to the ER 3 months ago for seizure-like symptoms, turned out to be convulsive syncope and pretty treatable with an adjustment of my medications. However, I've been in medical lockdown this pandemic because my asthma is out of control. My doctor, at my appointment over the summer, stared me down and said, "You can't get sick, do you understand? Your lung functioning can't drop any further. You have no wiggle room left, but seizures are an emergency, and could mean something bad, like a brain tumor." So I reluctantly went to the ER and sat in the waiting room. 10 minutes later, a COVID patient comes in. She announces to the front desk that she's been diagnosed and is having trouble breathing. She's instructed to take a seat and wait. Now, with all the social distancing, there's limited seats available. The only one left is one exactly 6 feet away from me. There's no place left for me to go, so I listened to her cough and wheeze and struggle to breathe for half an hour, absolutely terrified that I was going to catch the virus. I got called back for some tests and was given a bed in the non-COVID area, but it was in the hall. The hospital was so full that all of us non-COVID patients were crammed together in one ward. I was right by the doors that led into the COVID hall, and got to watch doctors in full hazmat suits walk around. I kept thinking it looked like a movie in there. And then a trauma patient was brought in and wheeled to an observation room. The curtains were pulled, but it was one of those glass-walled rooms, so you could still sort of see in. There were a lot of nurses and doctors running in and out. And there was a lot of blood, it was sort of pooling on the floor. The patient was yelling. Not screaming, but making those deep, loud, animal-like groans that says they don't have the air or energy for a full scream. And all of us, stacked up in beds along the wall, tried not to look, because it felt like we were witnessing something private. But those groans, they carried across the entire ward. It was terrifying. I could see some of the other patients trying not to cry. And to the other side of me, right over the cubicle wall, a nurse was on the phone talking about insurance and medical bills, and sounding bored and robotic, like she'd answered all of these questions hundreds of times before. It was absolutely surreal. I got out a couple of hours later, but the entire experience was just. I still can't find the words to describe it. I'd never been so afraid in my life. Afraid for myself, afraid for the patients, Afraid for the doctors. Just afraid for everyone going through it. My first memory, it's pretty vague, is from when I was 4. I got appendicitis and needed intimidate surgery as my appendix was about an hour away from bursting. I didn't understand all of this at the time, but from the perspective of 4-year-old me I was even more terrified than I would have been if I did understand. I remember my mom taking me to the ER, luckily it was fairly empty and we saw the doctor in about 30 minutes. The doctors said nothing was wrong and I probably had food poisoning. My mom told them to do a scan and they finally agreed. The scan was terrifying, and because I was so scared and wouldn't stop moving I had to be strapped down, which of course made it worse. By the time the scan was done my grandparents and brother had arrived and were in the waiting room. From then I just remember them putting me on one of those bed things and rushing me to the operating room. We passed my family on the way and I could see my grandfather crying, which I had never seen before, and haven't since, and so I knew this was bad. My mom was able to follow me to the door of the operating room. For probably 10 seconds after she let go of my hand I was reaching out to her screaming for help and we were both crying. Then one of the doctors put her hand on my shoulder and gently lied me down and I fell asleep. I don't remember anything after that, but it's still one of my worst memories to date. I remember when swine flu was the relevant pandemic. I was 7 months pregnant at the time and early one morning woke up so violently sick and struggling to breathe. I was usually very fit and healthy. I passed out on the bathroom floor and came round to paramedics moving me. I felt just about fine when I came round, was chatting away in the back of the ambulance, insisting it was just a funny turn and only the husband panicking. I was deathly pale but my obs seemed fine, but they were insistent on taking me to get checked over. We get to the hospital, I'm put in a side room on a bed, obs are again fine and I'm just impatient to get home but they still want to observe longer. I feel a little bit lightheaded, so I lay down, I start shivering, but any sort of movement to call the nurse felt like I was going to be sick everywhere. I started to have these weird visions like the hospital bed being on top of a really snowy mountain, climbing it, then crashing through the roof in a big jolt back onto the bed, hearing the heart rhythm on the machine all the while. Through all this I look at the machine but it's like I've gone too cold to move and it felt like I was watching it go slower and slower. It probably went by in moments but it felt weirdly peaceful, like I was letting myself go, and as my eyes started shutting I'm being shaken and shouted at and it's like I'm crashing back down to the bed in a jolt. I know the trolley's being wheeled along the corridor but it seems so long and wide and it's like I'm trying to keep up with it but keep losing sight of it. Everything to go black and my name being called and finding myself back on the bed looking up at a nurse, then each time falling off the bed out of my body, but it's like with each time my name's being called someone's picking me up from a big height and throwing me back down into the bed. Then I woke up in intensive care in one of those swine flu rooms. After being on the resus ward for 10 hours. I didn't know where time went at all. All of the above seemed to happen in the blink of an eye almost. It wasn't swine flu. My bloods, everything was fine. They couldn't say what caused it, but I was literally put on complete bed rest and fitted with a catheter for a few weeks to prevent whatever was causing it happening. It's still a mystery, but I certainly would have been dead now had I not been in hospital at that very time. My baby was absolutely fine. TLDR, had a day-long hospital stay after having to call an ambulance for abdominal pain, felt like my pain was minimized for me being a 19-year female, ended up having surgery after 11 hours of distressing pain, only to be sent home quickly by nurses who lied on the paperwork about my status. I grew up a completely healthy kid, but was oblivious of my family's health history. Out of nowhere this past January, I began having stomach pain that was diagnosed as ulcers. After 2 days of being on omeprazole, I began having attacks that would begin with the bottom of my ribs aching, then shortness of breath, and then horrific pain in my upper abdomen, mostly in the middle and somewhat to the right. These would happen randomly, and lasted about 30 minutes to an hour, but during them I couldn't do anything for the pain. No pain pills helped, no position, eating didn't help, nothing. But after the 30 minutes to 1 hour mark, the pain would just disappear and I would be fine. Went to the hospital when the first one happened, and they did an ultrasound and discovered numerous gallstones. Now, I'm 19, female, and in decent shape, so they were very confused as to why I had so many. But, my gallbladder wasn't inflamed and they didn't see anything blocking any ducts, so they said that they wanted to treat the ulcer to see if that was what was causing the pain. Ulcer pain and gallbladder pain are incredibly different, so this was frustrating initially. For me, the ulcer felt more like a gnawing, constantly hungry pain. The other pain I was having was the worst pain I'd ever felt in my life. So for a week after, I had these attacks on and off, but then they seemed to stop. I was hopeful, and knew that if I could make it to 2 weeks, the full course of omeprazole, then I should be fine. On the 2-week mark though, I had another attack, and from there they only seemed to get worse. I called my hospital's nurse line. where they told me that to get evaluated I needed to be in pain for longer than 2 to 3 hours. More on and off attacks, until the early morning hours of February 17th. Ironically, the day I had a doctor's appointment set to get set up with a primary care doctor, so that I could get the ball rolling to get my gallbladder out, since everyone knew it would eventually become a problem. I woke up at around 3:45 a.m. in severe pain and immediately called my boyfriend, hoping that the episode would pass and it would be okay. But things got progressively worse, until I was laying on my bathroom floor, throwing up nothing but bile, unable to move or barely breathe. I'd never felt complete fear until then, and that was the one and only time in my life that I've ever called 911. I was taken by ambulance to the same hospital I'd been going to, given anti-nausea and fentanyl, and the pain subsided somewhat and I was even joking a bit back and forth with the EMS. Once in the hospital though, the frustration began. The surgeons came and talked to me and made it clear that surgery was the best option, to get my gallbladder out. But then more doctors kept coming in, and courses of actions kept changing, and it felt like they were just trying to get me out of there. On top of that, the pain continued to come back, and they were giving me Dilaudid about every 2 hours. The first terrifying part was when a doctor came in and said that he didn't think my gallbladder was the problem. When I asked him what else it could be, he replied with, "Oh, you know, Garrett, acid reflux, heartburn." It felt to me that because I was a 19-year-old, alone in the hospital, with an ulcer, they were minimizing the pain I was in. And in tears, I told him that this wasn't heartburn, this was the worst pain I'd ever felt. I was terrified that I was going to be sent home to continue dealing with this pain that was hovering over me every day because this man didn't believe me. He said that he wanted to try GI cocktail and a PPI inhibitor, to see if the issue laid with my esophagus or stomach, and wait to see if that helped the pain. So I took it, it didn't help, and he finally agreed that surgery was the best option. They scheduled me to have a laparoscopic cholecystectomy, after being in the hospital for 11 hours in disgusting amounts of pain. I don't remember too much after that, as I was taking more and more Dilaudid, but I remember them taking me up to pre-op and the pain getting worse again. They had to spend more time to find the anesthesiologist and surgeon to see if I could have more painkillers before the surgery, and then they gave me fentanyl. Thankfully, they were rolling me into surgery, because I remember the fentanyl not helping the pain that time. I don't even remember counting back from 10. Waking up alone after surgery was the second most terrifying part. I can still remember the pain I was in, even after the nurse gave me another round of Dilaudid, and how I could barely get any food down. After the painful walk to the bathroom and changing, I had to stop because I was going to throw up. For this, the nurse went and got a dose of anti-nausea through my fore and handed me one of those smelling salts from her personal collection. I did not feel well enough to go home, but it felt like they wanted me gone, and my days after surgery were miserable. Reading through my paperwork afterwards, I found that my gallbladder had been nicked during surgery. And I was subsequently irritated, which is gross to think about. I also read in the nurse notes that pain was managed well, was able to keep food down, and wished to go home, none of which was true. My recovery was painful and troubling, with them believing that one of my incision sites were infected, but then telling me that there was just nerve damage on the top layers of my skin from the surgery.
WTF. I don't think I'll be going back to that hospital for anything else, and honestly, it scared me enough to not want to get any medical treatment.
My son fractured his femur during a seizure. It's horrible but can happen. Especially with kids with cerebral palsy who are non-weight bearing, like he is. He had to have his cast redone, because the top of it was digging into his thigh really badly. He's non-verbal and total care, so I asked for him to be sedated and monitored so he wouldn't be in pain and could relax. They were admitting him to the hospital, because they were afraid he had something else going on as well. Ortho decided against it, loaded him up with hefty doses of morphine and Toradol. They redo the cast and he's admitted. A day later they're talking about discharging him, but I'm noticing he's working super hard to breathe. Oxygen saturation is crap, like 89 to 90% on 4 liters of oxygen. They move him to the med floor, at a separate site, because of all the construction they're doing at the hospital. I didn't feel comfortable, because the PICU is at the main hospital and he's looking not great. He was a micro-pre-ME, he's 12, but has crappy lungs and I know him well enough to know when things look dicey. We get to the med floor and he absolutely tanks within a few hours. His respiratory rate hits the 50s, SOTs are in the high 80s, he's working super hard to breathe and has formula from 3 hours before sitting in his stomach. He has a G-tube, so I could see how much is in his stomach. He decompensated even further and I'm absolutely freaking out, fairly convinced he's about to end up on a ventilator. Thankfully, the respiratory therapist was phenomenal and basically took charge and got him the equipment he needed. X-ray showed an almost entirely collapsed left lung. They didn't move him back to the main hospital. Next night he decompensated even worse than the night before and ended up in the PICU at 1 a.m. because they couldn't stabilize him. First time since the NICU that I really thought I was going to lose him. He spent 20 days in the hospital, 18 in the PICU. Absolute scariest thing I've been through, besides his first few weeks of life. This came out of absolutely nowhere. Best guess, he aspirated while he was loaded up on morphine and collapsed his left lung. Never want to go through that again. After going out to drink one night and having not much at all, I blacked out. I was either drugged or had a bad reaction to hops, still not sure. Next day, I threw up non-stop for about 14 hours. When every muscle in my body was cramping bad enough I could barely move and my heart started acting real funny, I called an ambulance and went to the ER. They did every sort of test, gave me the runaround in a million different ways. But that wasn't the scary part. My parents had come, and the three of us were sitting in the room. At this point I was fine. In walks a doctor. He come in, says, "We got some tests back. Your white blood cell count is a little high. It could be leukemia," and then walked out without another word. They ended up shipping me off to another hospital to figure out what was going on and my dumbass agreed. Other hospital was super confused. 9-3 basically said you can throw up until you're dehydrated enough to not be able to hydrate yourself again, and I was perfectly fine now that I'd been rehydrated. But that moment where we were sitting there contemplating the fact I may have fucking cancer in my blood, that was terrifying. I don't have leukemia. I probably just have a hop intolerance. I was staying in a low security mental ward. I had let my insomnia get the better of my life and mental health and absolutely had to be admitted to get my medication and sleep schedule back to a productive place. While there, you get to be friends with other people doing long stays. I became friends with a guy that was a little bit younger than me and didn't really think anything of it. However, this guy started to become a little unhinged and really started only focusing on me. It got to the point of where he was waiting for me outside my room all the time, eating what I was eating, stuff like that. Hey, maybe I'm being a good example because I'm getting better and he wants to do the same. No hope. Turns out, he had paranoid schizophrenia and thought I could cure him. It came to a head one day where I was trapped in the rec room with him until our doctor could come, since he would literally freak out if I left his sight. The last time I saw him, he was being escorted to the high security ward, mumbling my name over and over again. He wasn't breaking eye contact with a cold, unnerving stare, and he held an outstretched hand towards me as the double security doors closed. I think about that stare when I don't prioritize my mental health and get the shivers every single time.